Any takers on this one? Yeah, I mean, I just don't think there's anything else that this could be except synovial sarcoma, right? It was, I can't remember if it was like a arm mass in a middle-aged adult and a core biopsy. And here we have a cellular spindled proliferation, and the spindle cells are very uniform. They are mitotically active and kind of hyperchromatic, but they are not pleomorphic because it's a translocation sarcoma, right? And I would say that by far more common, I see monophasic synovial sarcomas that are completely composed of these uniform spindle cells, often arranged in kind of fascicular herringbone pattern. And only occasionally do I encounter the biphasic ones, which is it's kind of like a rare opportunity to see them. And this was like the best example that I had seen for a long time because it's got this perfect glandular-like structure. The tumor cells make and have an epithelioid morphology and arrange into these glands. The glands often look like they have kind of mucin in them, but actually a lot of times it's kind of degenerated, kind of beginning of necrotic tumor cells. At least that's how Dr. Weiss explained to me that a lot of times it's kind of debris from dying tumor cells that mimics secretion in a lumen. And so the presence of those together, I mean, it almost reminds you a little bit of like the endometrial glands and stroma. I mean, not really, but it kind of has that same kind of pattern of glands with columnar sort of cells and this very cellular spindled stroma. So in any case, though, as an extremity lesion, I think if I recall, I actually just signed this one out on H&E with no molecular or immunostains because I just said there's to me nothing else that this could feasibly be. And then on excision, of course, that's what it was. So this is a really classic, as good as it gets example of biphasic synovial sarcoma. And I'll often mention if it's monophasic or biphasic, but in reality, to my knowledge, there's no difference in prognosis or treatment between them. It's just a morphologically interesting thing. So I think the main thing to learn when you see the biphasic, that's good, but recognize the uniform monotony of the cellular spindled area. I mean, really, when I first saw synovial sarcomas, when I first started residency, it reminded me a lot, and maybe I'm just not good, but it reminded me a lot of like ovarian stroma. I feel like the cellular blue, very uniform cells of ovarian stroma could kind of have a lot of similar appearance to what you see a synovial sarcoma look like. And I got a whole long video about synovial sarcoma, so you can learn all about it if you want to.